Ready to master the basics of intubation? Let's dive in. Intubation is a critical skill in the medical field, especially in emergency and critical care settings. Whether you're a seasoned healthcare professional or a student just starting out, understanding the nuances of this procedure can make a significant difference in patient outcomes. Intubation, also known as endotracheal intubation, is all about securing a patient's airway. This procedure is essential in situations where a patient is unable to breathe on their own due to various reasons such as trauma, surgery, or severe illness. By securing the airway, we ensure that oxygen can be delivered efficiently to the lungs, which is vital for the patient's survival, to ensure they can breathe properly. The process might seem daunting at first, but with practice and a clear understanding of each step, it becomes a routine part of patient care. Let's break down the process into manageable steps. First up, sedation and paralysis. This is a crucial step because it ensures that the patient is comfortable and their muscles are relaxed, making the intubation process smoother and less stressful for both the patient and the healthcare provider. The patient is given medication to make them comfortable and relax their muscles. These medications are typically administered intravenously and work quickly to prepare the patient for the next steps. This step is all about making the process smooth and stress-free. Next, visualization. Visualization is key in intubation because it allows the healthcare provider to see the structures they need to navigate. A laryngoscope or a video laryngoscope comes into play. This tool is essential for getting a clear view of the patient's vocal cords and the upper part of the windpipe, which is where the endotracheal tube needs to be placed. This handy tool helps us see the vocal cords. The laryngoscope has a light and a camera that provide a clear view, making it easier to guide the tube into the correct position, and the upper part of the windpipe. This visualization step is crucial because it ensures that the tube is placed correctly, reducing the risk of complications. Now for the main ACT tube placement. This is the step where the endotracheal tube is carefully inserted into the patient's airway. The endotracheal tube is inserted through the mouth or nose. The choice between oral and nasal intubation depends on the patient's condition and the specific circumstances of the procedure, and gently push down until it reaches the windpipe. This requires a steady hand and a good understanding of the anatomy to avoid causing injury. It's a delicate dance of precision and care. The healthcare provider must be gentle, yet firm, ensuring that the tube is placed correctly without causing trauma to the patient's airway. Once the tube is in place, it's time for tube stabilization. This step is crucial to ensure that the tube remains in the correct position and does not become dislodged. A small balloon at the end of the tube is inflated to keep it secure. This balloon, also known as a cuff, helps to seal the airway and prevent air from leaking around the tube, and the tube is taped to the corner of the mouth. Finally, confirmation. This is the step where the healthcare provider ensures that the tube is in the correct position and functioning properly. A physician will check the placement by listening to the patient's breathing, monitoring CO2 levels, or even taking a chest X-ray. These checks are essential to confirm that the tube is in the right place and that the patient is receiving adequate ventilation, or even taking a chest X-ray. The chest X-ray provides a visual confirmation that the tube is correctly positioned in the trachea and not in the esophagus or another incorrect location. Peace of mind that everything's in the right spot. This final confirmation step is crucial for patient safety and ensures that the intubation has been performed correctly. Believe it or not, intubation can be done in as little as 30 seconds, depending on the skill and experience of the healthcare provider. In emergency situations, every second counts, and being able to perform a quick and efficient intubation can be life-saving. And the whole process usually takes no more than 5 minutes. So why perform intubation? There are several reasons why intubation might be necessary. It's all about protecting the lungs of patients who can't protect their own airway. This includes patients who are unconscious, have severe respiratory distress, or are undergoing major surgery, and are at risk of breathing in fluids. Aspiration of fluids such as saliva, blood, or stomach contents can lead to serious complications, including pneumonia and respiratory failure. It's a lifesaver, literally. Intubation is a critical procedure that can make the difference between life and death in emergency situations. And there you have it, a quick and clear breakdown of the intubation process. By understanding each step and practicing regularly, healthcare providers can become proficient in this life-saving skill. Stay sharp, stay safe, and keep learning. Continuous education and practice are key to mastering intubation and ensuring the best possible outcomes for patients.